All right, thank you for staying with JK Live. Let's take the final round of questions really fast and then take closing remarks. Yes, sir.
I'm Brian, and thank you for the opportunity. So I have two questions. So at times, there are patients who are required to go for medical assistance abroad. Will the SHA be able to cater for their expenses when they are there? And second question is, NHIF had some limits of the amount to pay for the patient. So what is the maximum amount of money that SHA can be able to cater for the patient who is in any hospital here in Kenya? Thank you.
Thank you, Brian. Elijah.
Thank you very much. For conditions that cannot be treated locally, SHA will finance the treatment abroad.
Okay. Are there limits to pay?
Different conditions have different limits. So there are conditions we shall pay up to millions. There are others we shall pay up to 100,000. There are others we shall pay up to 10,000. It depends on the disease.
Okay.
Thank you.
Question in between here? Yes, you have the microphone.
Hi, everyone. My name is Tony. My question goes to how do SHA collaborate with healthcare providers and community? Thank you.
Okay. Yes. Any of you can take that.
Thank you. I think that is important. Collaboration is important in terms of service delivery. SHA will work really closely with communities and healthcare providers so that we can be able to have optimal health outcomes.
Okay. The question back there, yes. If you have the microphone on that side. If none, yes. Yes.
Okay, thank you. My name is Sylvia. You talked about inclusivity of all students. So is there an age limit? Because you have a university student who is 19 and there's another who is, let's say, 27 and above. And if there is, are there any plans to collaborate with universities and colleges to make sure that students have easier access to SHA health services?
Age limit.
Thank you very much. Age limit, 25 years. Thereafter, you are considered a household.
Okay. Final question, yes.
Jambo. My name is Mutiso Justus. My question is, if SHA fails, what's the next move? And again, how can a government parastatal steal from itself?
Okay.
Thank you.
PS, what if this fails? What next?
We've made a provision in our laws to make sure that it doesn't fail. It is anchored in the law, so it will not fail. What has been failing and loopholes that has been leading to fraud, and therefore sometimes to seal those loopholes requires that we change the laws. For this case, it required that we change the laws and create a new authority.
Okay, final question there. Yes.
Thanks. My name is Ezekiel Okukwachieng, and I have some questions here that maybe I'll need the officers to address. My first question is that what is the difference between SHIF and SHA? The other time, when the system of SHIF was being launched, there was some issues and the case was taken to the court, and it was dragged there. And after that, you came up with another system called SHA. And now, what if this system again, another person decide to take it to the court? Will you again shift to another system? Maybe you'll call it even SHA. So maybe...
Okay.
So what are some of the best... the criteria you've taken or the principle you've taken for this new system, this SHA, to work effectively? Because the other one is still in the court, it was dragged there. So I don't know if this one also, maybe a person will decide to take it to the court, will also drag in the court.
Okay.
So maybe you'll tell us more. Then my last question is that I'll just want to know the minimum amount of people who are insured in that system. Because you might find that, like in NHIF, there were some people that were placed there, like, let's say, I don't know the number, but let's say the minimum was 4. What about if a family has got even 13 children?
Okay.
What about the rest?
Great. Elijah, you answer that, then we'll start
Thank you very
closing remarks
much.
from the DG.
First question, the difference between SHIF and SHA. SHA is the organization that manages 3 funds. One fund is called Primary Healthcare Fund. The second fund is called Social Health Insurance Fund, otherwise called SHIF. And the third fund is called Emergency Chronic and Critical Illness Fund. SHIF is not an organization, and SHIF has never been taken to court. The organization that was taken to court is SHA. After SHA was taken to court, the government appealed. The judges saw merit and pronounced themselves as much in the appeal and granted a stay of execution. Stay means continue doing what you are doing. Continue registering Kenyans. Continue doing what you are doing. And that stay has been extended until the appeal is determined. So the one thing that I would like to clarify loudly, SHIF is one of the 3 departments inside this organization called SHA. Thank you.
Is there a minimum and maximum number?
There is no minimum. Actually, the minimum number in a household is 1. And the maximum is infinite. So it is okay to have 5 spouses and each spouse to have 10 children.
Okay.
Thank you.
All right. Zainab, closing remarks. What is the one thing you want the people to hear from you tonight?
Allow me to say mambo matatu.
Okay.
When you register for SHA, uko na access to services ya level 2, level 3, nurse dispensaries and health centers. Kabla hata hujalipa. Kama umelipa, contribute to Social Health Insurance Fund, you have access to level 4, 5 and 6. Na hiyo ni ile specialized services. Kumbuka, kama hata hujalipa ama hujaregister, ukiwa na emergency, you have access to 24 hours of services immediately after. Ukikuwa na accident ama heart attack ama any emergency as defined, you have access to those services without even registering. Mambo matatu, kumbukeni hizo.
Okay, thank you very much. DG?
For me, my closing remark is to urge Kenyans to be able to register. This benefit package is better than what was there in NHIF previously. So we should all embrace it, move together, roll it out. If there are challenges, we address them together for the benefit of all Kenyans.
Okay, Wachira?
20 years ago, we used to have very many harambees for students going to schools. The government came in with systems that made sure that we do not have those kind of harambees. Today, we have so many WhatsApp groups that are calling us to fundraise for health. The vision of SHA is that within a year or so, these WhatsApp groups will not be there because the government will be offering quality service at predictable, affordable premiums. Thank you.
Okay. Yes, final one.
Thank you. I want to say that I know you've talked about your contribution of 2.75%, whether you will get commensurate service. I want to assure you that once you contribute your 2.75%, you will be able to get commensurate service. And 2, as a Kenyan, the social health insurance that we have developed is for all Kenyans, and it brings us together. For those who are young, they contribute for the old. For those who are healthy, they contribute for the sick. And therefore, it's all inclusive. Let us build our social health insurance. Thank Thank you.
All right. Thank you all so much for making time. Harry Kimtai, PS, State Department for Medical Services at the Ministry of Health, Dr. Patrick Amoth, Director General, MOH, Elijah Washira, Acting CEO, Social Health Authority, and Dr. Zainab Gura, Acting Deputy Director General, MOH. Thank you all for making time. We have extended the time, but it is still not enough. So this is a conversation we'll keep having over time so that you get all your questions answered. On behalf of the entire team that made this possible, we say thank you and good night. And special thanks to the University of Nairobi for hosting us right here at the Taifa Hall. And thank you all for staying this late. It's almost midnight. We appreciate your time. Thank you very much for staying with us. And that's where we close JK Live for now. My name is Trevor Ombija. It's always a pleasure having you with us. Bye for now.